Why is Juvenile Arthritis Awareness Month? Now, juvenile arthritis itself is not a specific diagnosis. It's more a compilation of a group of conditions or diagnoses that run together, particularly in pediatric patients. These are usually autoimmune or inflammatory conditions. So what is autoimmune condition? An autoimmune condition is when your immune system starts making antibodies that attack your own tissues as being recognized as foreign. So typically your immune system is there to help you fight off infection and recognize if there's a bacteria or virus or something in your system that is not part of you. In this case, for whatever reason, your immune system has started attacking your own tissues, usually a specific type of tissues, with antibodies that you're making against your own tissue because it's recognizing your tissue as being foreign. Most commonly when this happens, it's usually attacking skin or connective tissue that is found in the skin or muscles. But connective tissue can surround or be part of pretty much any organ in the body. So you can also get what we call systemic involvement, where you have an organ or organ system that may be being attacked as well. About 1 in every 1,000 children develop some form of a chronic type of arthritis. These disorders can affect children of any age, but is rarely seen under 6 months of life. Pediatric rheumatic diseases usually affect children under the age of 16, and there's roughly estimated around 300,000 children in the United States currently with some form of a pediatric rheumatologic disorder. If symptoms are lasting more than 6 weeks, it's usually considered to be chronic, and symptoms usually overlap in these conditions. They may include things such as pain, joint swelling, stiffness, redness, or warmth. They most commonly affect the musculoskeletal system, but again, the joint involvement may be minimal in some cases, or minor, or even non-existent, or it may affect many joints. Again, it can also affect other organs throughout the bodies. Commonly can affect your eyes, which may or may not be silent, showing signs of eye injury or disease. Again, frequently affect the skin, which can be manifested by a rash. Will affect your muscles and can often also affect your gastrointestinal tract, including your liver. Different types of juvenile arthritis. Again, this is a compilation of disorders together. The first one that we're going to talk about is juvenile idiopathic arthritis, most commonly referred to by most people as juvenile rheumatoid arthritis. This is considered the most common form of arthritis, and it has 6 different subtypes, including oligoarthritis, polyarthritis, systemic, enthesitis-related disorders, juvenile psoriatic arthritis, or undifferentiated. In oligoarticular juvenile arthritis, there are usually fewer than 5 joints in its first stages of presentation, but can increase to more. About 1/2 of the children who have a juvenile arthritis is usually this particular type of arthritis. Girls by far are at a higher risk of developing than boys. Some of the older children who develop this juvenile form of arthritis may develop into extended form arthritis, where those will continue to have persistent attack of their joints even into adulthood. Children who develop this particular form of arthritis who are younger than 7 years of age actually have the best prognosis of having this go into remission and not having it continue on into extended period of time. Again, with this particular form of arthritis, you're at higher risk of having eye involvement, which can be seen as either iritis or uveitis. It is an inflammatory condition of the eye. If the inflammation persists on long enough, it can potentially lead to blindness, so this does need to be treated. The eye inflammation and symptoms can occur independent of what's going on with the arthritis. Because of the eye symptoms do not always occur on a regular basis, or may not always have symptoms manifested with it. If you have a child who has juvenile arthritis of the oligoarticular type, or most commonly the rheumatoid type, you should be getting regular eye exams done to make sure that they are not having inflammation that is taking place that is not being manifested. Polyarticular or polyarthritis is frequently seen with 5 or more joints at the onset of diagnosis or presentation. This is most commonly seen in teenagers. And this may actually be a form of rheumatoid arthritis that actually might be the adult form of rheumatoid arthritis. It just happens to be being manifested a little bit earlier in life than what we typically see. Systemic juvenile arthritis is again going to attack more of the organs. This is seen in about 10% of children who have a juvenile arthritis. It usually begins with fevers that are going to be a fairly high fever, around 103 degrees or higher. and can often be accompanied with the salmon-colored rash that comes and goes. They can also, again, have inflammation of other organs because this is affecting the connective tissue that does hold your other organs together, particularly gastrointestinal tract and such as your liver. You may see involvement with these conditions. They may have joint swelling that may not present for months or even years after they actually start to manifest with the systemic symptoms to begin with. They may show up with anemia, which is a low red blood count, or an elevated white blood count during the course of arthritis with having these fevers. So oftentimes this might be misconstrued as having some form of an infection. And this arthritis can continue to persist even years after the fevers have resolved and other symptoms have disappeared. So they might present initially with a fever and what might look like an infection, and then years down the road develop the attacking arthritis part of this disorder. With juvenile psoriatic arthritis, typically the children will present with both not only the joint involvement with arthritis, but also have the skin condition of psoriasis. There's usually a very strong family history component of this, such as a parent or sibling. Usually they may also have nail involvement as well as finger involvement or toe involvement, where they get a widespread swelling of their fingers and toes called dactylitis. In enthesitis-related arthritides, these are usually involving the ligaments as well as the spine. So typically these are going to be disorders of inflammation of the spine, such as ankylosing spondylitis or spondyloarthritis. In this group of kids, they may have pain without obvious joint swelling. Their biggest complaint may be back pain or stiffness. And again, usually there may be other forms of a history of arthritis of the spine in the family. Other related conditions that could be seen grouped into the juvenile arthritis family include juvenile dermatomyositis. Again, this is an autoimmune condition where you're attacking both the skin and the muscles. They may present with a skin rash, particularly on the eyelids or on the back of their knuckles, and they usually will present with muscle weakness. The next one is juvenile lupus. Again, this is a systemic condition where you're attacking the connective tissue throughout the entire body, so they can see involvement of their joints, their skin, kidneys, affecting their blood cells and any other area of the body. In juvenile scleroderma, scleroderma itself literally means hard skin. The skin becomes very thickened, plastic looking, and scarring. You can see changes in the face or neck. If it's in a very aggressive form, that may develop where the skin will harden and tighten over time. Very young children very commonly may get what's called Kawasaki's disease. Again, this may present with systemic symptoms with having a fever, but it's predominantly a vessel inflammation where it's attacking the connective tissue of the vessel system. And in particular, if it can attack the vessels of the heart, and they may get some aneurysms in the heart vessels, and this usually needs to be looked at if there's suspected Kawasaki's disease. There is also mixed connective tissue disorders where it might look like one or the other, but might actually be a compilation of two of those disorders, as previously mentioned, combined together, such as features of both arthritis, the lupus, the dermatomyositis, or scleroderma, all combined into one. In this case, they're usually going to have testing done, which is going to show very high levels of a particular autoimmune antibody or anti-nuclear antibody called an anti-RNP. Another condition that is clumped with this group of disorders is juvenile fibromyalgia. At this point, fibromyalgia is not directly believed to be an autoimmune condition. Perhaps that might change down the road, but at this point there are not the autoimmune markers that we can test for in these other conditions that would be found typically in fibromyalgia. But it is also a chronic pain condition or syndrome where you might have arthritis-related type symptoms, stiffness, aching, fatigue, disrupted sleep, or dysfunction that might come along with this. Usually this is not going to develop before puberty, and again, usually higher risk in girls than in boys. So what causes juvenile arthritis? Well, again, this is an autoimmune condition predominantly where your immune system goes awry and attacks your own connective tissue, joints, and it may, as I said before, have other organ systems involved in this. Attacking of this connective tissue causes inflammation, and the inflammation can then result in pain. It can also trigger the interleukin pathway throughout the body, which is why you can get fever associated with this, and can ultimately cause joint destruction, which is where you get the arthritis part of it. So that's the main reason that we want to pick up on these disorders and treat them early so that we're not having significant destruction of the joints that are involved. At this point, there is no clinical evidence that diet or emotional factors play any role in developing an autoimmune disorder. It is primarily believed to be a genetic condition, and so there is a significant component of hereditary that may be passed on amongst family members from generation to generation. But because of this, there is also no known way to prevent these conditions from developing. There is also no direct evidence to support any theories that this may be brought on by toxins or allergies either. So if you or a child suspect that there might be a problem with juvenile arthritis going on, the most important thing is first get this diagnosed. Go to your provider, make sure that they're getting autoimmune testing done to look and see if there's any evidence of autoimmune antibodies present in your system. And if there is, honestly, this is one of those areas where you probably really should be seeing a pediatric rheumatologist, a specialist who does pediatrics, meaning that they work with children, but they specialize in disorders of the bone and joint system and the autoimmune systems, because these conditions, again, can be very aggressive in attacking joints and connective tissue and tendons. And this is a destructive condition if it's not picked up early on and treated aggressively. And the whole point of treatment is to, one, try to get the symptoms into remission so that it's not continuing to attack your connective tissues and joints, so that we're not having significant organ involvement go on. But also we want to prevent deformity, destruction, and debility in the long term by treating these conditions early on. Most children who have juvenile arthritis go on to lead a very effective, productive, healthy lives, especially if you get this picked up on and treated early on. It's a very rare condition or situation where you might have a child that becomes fairly debilitated because of the degree of the inflammation and the attack on the joint and tissues. Sometimes even with treatment, there may still progression, and some children may go on to have deformity and debility. But if you pick this up early on and treat aggressively, usually that is not the case. There is no treatment cure at this point, so really the goal is remission. If we can get you treated early on, then hopefully we can reduce, again, the attacking and inflammation of the joints and of the connective tissues throughout the body, which also may involve the organs. Also, this will help to control pain and other systemic symptoms such as fever that may occur. Again, we also might see signs of rash, so hopefully this will also help take care of any problems with rash. And the goal overall treatment is, again, to have the child's life be as healthy and productive and rewarding for them as it possibly can. So if there are children that do have problems with having significant joint destruction and debility, there are accommodations that can be made in schools or in their environment that might need to be done for them. And so we advocate for that being checked into to make sure that we're getting all the services and needs that we need to be able to help that child to be able to continue to stay in school and be at the level of functionality that we would ideally like them to be, or that they want to be. But that also means that we have to address self-management. We need to make sure that the child understands the importance of taking medications the way they're supposed to be taken and being compliant with that, and that they are doing those things that they can do to be as healthy as possible, such as eating a healthy, balanced diet. So I hope this has been helpful. If you have a child that you suspect of having a juvenile arthritic condition, as mentioned above, please get them into a healthcare provider. Let's get that checked out. And let's try to make sure that we're doing everything we can to live life to the fullest of our potential. And until next time, Pura Vida, this is Dr. Radley, family physician, St. George, Utah.